The goal is to highlight different van journeys. The panelists have fascinating perspectives and stories to share, so you have a starting point, a benchmark, a comparison, and a companion as you plan your next steps. You'll see how different each approach to van is and hear the challenges and constraints experienced and the creative solutions that the teams have created. This panel will focus only on sharing from the panelists, as you will have the next 3 days to engage with them in success stories, solution seminars, and poster sessions. As such, we encourage you to write down the questions you have in your action workbooks and follow up with the panelists in the coming days. Leading this panel is a woman I look up to. She has a bad day anytime there was a report of medicine stocked out at health clinics. This is because in the last 17 years since qualifying as a pharmacist in Nigeria, she's discovered that her happiness flourishes when she supports people to access medicines wherever they're needed. Since 2005, Ramatu Abdul Qadir has been fulfilling her pursuit for happiness, beginning as a senior pharmacist and then elevating through the rank to chief pharmacist in the only ear, nose, and throat treatment center in West Africa. She also invests actively in the development of the new generation of passionate pharmacists as a lecturer at Kaduna State University. In addition to collecting degrees and accreditations, Ramatu is also a member of the Nigerian Health Research Ethics Committee. She has written and publishes scientific articles in several peer-reviewed research journals and is now concluding her own PhD research in the field of neuropharmacology with a focus on finding treatment for autism, a neurodevelopmental disorder that impacts learning abilities in children. Ramatu is mother of two. In addition to working to ensure availability of life-saving medicines as the executive secretary of Kaduna State Drugs and Medical Supplies Management Agency in Nigeria, she also tests herbal extracts in her neuropharmacology laboratory, and you'll also find her at the Al Isfar Academy, providing affordable, high-quality nursery and primary education to children from the suburban communities in Rigasa New Extension, Kaduna. We are so lucky to have Ramatu join us as a moderator, presenter, and leader over the next 3 days. Please join me in giving a very warm welcome to Ramatu Abdul Qadir. And I'll now ask the entire panel to please come join us on stage.
Good morning, all, and thank you very much, Deborah, for that beautiful introduction. Thank you. So I'll be moderating on today's program, Van Jumpstart Workshop. And on our panelists, we have Harshal Hackinson. So we have Harshal Hackinson, business planning leader, South and East Africa, Procter & Gamble, with us today. Harshal, welcome. And we have Khadija Jamaluddin, Director, Affordable Medicines, National Department of Health, South Africa. Khadija. And Manish Pant, Senior National Program Manager, United Nations Development Program, India.
Hi, everyone.
We also have Mustafa Mahmoud, Director, Logistics and Health Commodities, National Primary Healthcare Development Agency, Nigeria.
Good morning, all.
With us is Ruth Bechel from Mozambique, Country Director, Village Reach, Mozambique.
Good morning.
So, I'll start with Harshal. And we'd like to know, how did you build your van? What triggered you to build your van? And what is the process of getting your data and technologies you use?
Okay, so from a P&G perspective, I think let's start with what triggered the van. The van really was triggered by a business need to reduce costs, improve cash and service across the supply chain. And that was the main trigger. Once we understood what was the business need, we went from there and said, where do we have the center of expertise today in the region? And we built the van in that location because that's where we had the major part of our business being transacted. If we look at the process and information flow, in a market like South Africa, we would have the standard platforms, SAP, Oracle. But I want to share an example from East Africa, where today we have a distributor that couldn't plan but on paper, right? He had to place all his orders on paper. He was doing transactions on paper. And that's the level of difference you have between South Africa and Africa. And they were managing their business today on Excel. So I think it's important to note that you can use the standard platforms, SAP, Oracle, those are available. But in the countries and the markets we are playing in today, Excel, paper works. You have to look at what is the business need at that point in time and work from there. And I think that's the critical part that you need to follow to deliver success on the van.
Sounds familiar. Yeah. So, Khadija, what would you say about that, your processes? Are there anything like that of Harshal, or do you have different experiences to share with us?
I think for us in the public healthcare sector, our experience would be different because our aim and focus is the patient, making sure that the patient gets their medicines. How do we build a resilient healthcare system? What triggered us building our van was the stockouts that was reported in 2013, 2014, which I'm sure many well-developed countries also experience. But we feel it more in South Africa, or rather developing countries, because our healthcare systems are not as resilient, they're not as robust to withstand whatever impact it's facing. So that was the trigger, making sure that our patients get their medicines, and we don't want to have any stockouts. The stockouts in South Africa were so severe that it actually triggered a Human Rights Commission investigation. So, that's taking patients at the center, making sure that they get their medicines. We're not compromising anybody's healthcare. How did we build our van? We built it in stages. So it started really at the very basic level. So we started with the MPC, which is our Master Procurement Catalog, putting all medicine information relating to contract information, pricing, and just having that one little tool available actually galvanize the entire van development process. So it's in stages. Then we did a few pilots in certain districts and provinces. And just from there, when we saw the value that we're getting, when we saw the utility that we're having with implementing innovative ideas, it then just escalated. I think it was Dr. Phil who said that you can't do the same thing continuously and expect a different result. For us in the healthcare system, it's always saying, oh, we just have to do this, we just have to do that. Obviously, there was something that was needed, something different, something, really, I wouldn't want to say catastrophic, but the positive part of catastrophic. But you needed something really, to take this process forward, to make sure that people come on board, that we serve the people that we're here to serve, making sure that they got their medicines, but doing it in a way that brings everybody together. Because if you're developing a van, it's not just pharmacists, it's not just pharmaceutical manufacturers, it's a global organization, and when I say global, I mean internationally as well. So you have your suppliers, you have your regulators, you have your patients, you have your healthcare workers, you have your supply chain specialists. So just making sure that, as pharmacists, we tend to be very siloed in our approach. And what we needed to do was break that silo approach and make sure that we bring everybody on board. And building our van actually enabled us to do that.
Interesting. Manish, do you agree with that? Did you have the same experiences like Khadija?
Yes, though we didn't have the Human Rights Commission set up in India, thankfully. So, but yes, I think the challenges, and I'm being very specific for vaccines, unlike other commodities. I think you probably spoke about other commodities as well. So I think the challenge for us in India was and in India, about over 80% of the vaccine delivery is through the government public health system. So government is also the largest procurement agency for the vaccines. The challenge was of the visibility of those vaccines. Where are they? Are they being stored in the right amounts across the huge network of primary health centers and district stores, state stores in a huge country like India? Are they being stored at the right temperature? These were some of the key questions. And a lot of the stock keeping was manual, was very parochial, was very haphazard and ad hoc. So there was a felt need to get a system that standardizes the stock management manually, but then also how can we provide a real-time monitoring information system that can also do the analytics and trends analysis and a lot of other things that can help decision making for program managers at the last mile, but then also at the first mile. And so that was the basis on which we started in India.
Okay. Mustafa, do you also have the same experiences? How did you start your van?
Thank you. We had almost similar experience with South Africa in terms of stock out of medicines everywhere, but ours was, I think, more grievous in the sense that the whole entire logistics system was ineffective, was not able to deliver what it ought to deliver at the right time. You didn't even have the storage ability to store the vaccines. Basically, we deal with vaccines anyway. So it was more of a bigger system issue. I mean, the stocker was just one component of the myriad of symptoms that the entire system had. So what we did was we actually said, well, if we need to correct this, I think we need to engineer something fresh, new. We began a whole series of transformation across the whole system. I think data visibility was one of those important things that we considered very early in the day, that if we need to get it right, then we would need to get information as to where all these products are, as to the functioning of all the equipment, as to how the people are managing these issues. And I think this is one of the most important things that actually triggered the whole journey of the van. And in terms of processes, what we did was that the things that we had, the data systems around us that we were using was not giving us much. So what we did was just go around those systems, build them up, and see whether you could take them to another level. But one of the most innovative one was the dashboard. We just said, oh, guys, people are already used to SMS. They know how to use these things. Why can't you collect the most basic information from what the people know how to do? And we started the journey onto the dashboard. And then we built it, bring in the technology later, define all the processes around it, and make sure that everything works very well. That's our own experience into how we get the van working. But we also leverage on the conference. Thank you, David, for taking us to the van workshop. You broadened the vision for us. Thank you.
Okay, Ruth, did you also build yours from the scratch, like?
Yeah,
Mustafa?
definitely. We did. And the problems we're trying to address in Mozambique are really similar to the other countries that I've just shared. In Mozambique, we started the van working with the vaccine, the EPI program. And what triggered it is the fact that we needed to have a better system to increase the accessibility of vaccines at the health facility level and reduce stockouts or eliminate them as far as that was possible. And so with limited resources available in the country, we had to think of ways to optimize the system so that we can get the vaccines there, but at the same time get data so that we can introduce the system of or the habit or culture of using data. So we developed a system that we call the dedicated logistics system. And this system incorporates most and all of the van principles. Because that is a system that sort of like was improved from the original system in the country, and it was piloted in one province instead of having the multi-tier distribution system that was rather expensive and had very issues of stockouts. We introduced this system that skips a level and does distribution loops into the health facilities. So then we had a team of people that were trained as logisticians, and they also collected the data at the source, like at the health facility level. So bringing this data back into and uploading it into a system that generated reports made it possible then for that province to begin visualizing data and being able to use that data for planning. And so that then was other provinces beginning to be interested in the system, and then it was increased into 3 additional provinces, and eventually the central level in the Ministry of Health, began to be interested as well in that system because they were seeing the evidence of better performance from these 4 provinces that were implementing this system. And so then the ministry was interested in scaling this up to the rest of the country. And this is when we begin to think about putting somebody in the Ministry of Health that would build that capacity for the Ministry of Health, the EPI team. And so an advisor is now placed in the Ministry of Health, and he works with the EPI team. And this advisor, we call him a Venn advisor, but he's also known as the human tower. And so Timoteo, who is here with us in this workshop this week, will share more about what he does in the Ministry of Health. But one of the things that he does is building the capacity and instilling the culture of using data within the Ministry of Health. And he does that by also increasing the data, the capacity to collect and manage data and analyze the data and use the data for making decisions and for planning and for improving performance.
Thank you, Ruth. I think we're having some very interesting discoveries today, like the human tower is epic. You can find me at Mozambique stand the whole day. I'll be finding out about that. So I'll come back to you, Harshal. What is the one unexpected benefit you realized from your VAN implementation or data-driven decisions?
I think from a P&G perspective, if we look at our VAN today is based in Egypt. It services the entire Middle East and Africa and India. Even though we have that distance between us and the markets that we service, the speed at which we make decisions has not changed. In fact, it's got faster and better. And that's driven by the fact that you have the right stakeholders in the van making the right decisions at the right time. And that's critical because if you have full visibility across the supply chain, the speed at which you can make decisions to affect the future is much better. So from a P&G perspective, the benefit that we didn't realize initially was the fact that we had stakeholders in the right location with the right expertise that could make the decisions that could really impact the full supply chain as early as possible. And that was unique. We weren't expecting that.
All right, Khadija, any unexpected benefits?
I think there's more than one unexpected benefit. I think the fact that you now have objective information. So previously, people would be, they'd be skeptical about the quality of the information they receive, and suddenly you've got this objective information, which people then buy into, and the realization that because you have this information, what do you do with it? You realize, okay, it's not just me in the supply chain; it's part of the value chain. It's what do we bring together as an organization? All the pieces fitting together. What for me is really a pleasant benefit is the cultural change that has taken place, especially at facility level. So we have facilities at district level using the information, but actually being competitive about their medicine availability. So nobody wants to be in the red, right? So that's the really pleasant, unexpected benefit. But the main thing, I think, is the fact that you now have objective information from which you can make your decisions. And, you get buy-in from all levels, from your suppliers. And you'll see the team demonstrating how we manage our suppliers using the information that they provide, to right down to facility level and how they effect that change. So the VAN is about continuous improvement. And I know we said we want to strive for perfection. And we're doing that. We're not where we want to be, but you can see the change, and that for me is really awesome.
Manish, I'll come back to you now. Did you also have any unexpected benefit?
Yes, yes, in fact, more than one. And one of it is similar to what Herschel mentioned. You see, I'll start with the last mile, because all across the value chain we are seeing benefits. The way we set up, or we are setting up the VAN in India, it's called EVIN, the Electronic Vaccine Intelligence Network, is that we use the last mile worker in the system who is managing the vaccines, and gave him a mobile phone with a simple application to actually digitize his vaccine stock. So we bought ownership from him or her right at the beginning, and we kind of branded this whole process so that they feel proud to be part of this network, and they're contributing and things like that. So we did a bit of branding around EVIN. So to begin with, we got a benefit that we got a very good buy-in from the main man or woman who's going to enter data into the system. And as a result, we are now seeing that the data is being entered regularly. Over 95 to 98% of all cold chain handlers are now entering data after every session. That's huge. That's a really huge number. So we are reasonably sure of the quality. The second benefit was that this particular person at the last, he's at the end of the food chain, so to say. He's the last guy, and they always have the pressure to deliver from their higher ups. Now they are more empowered, and we are getting anecdotal references from the field that they say that, okay, now because I'm entering my data on time, and it is a district or the next higher level of stores who are now supposed to monitor and see whether I'm stocking out or not. So the responsibility and the accountability of stocking out or adverse stocks has now shifted from me to the next higher level. So in a way, they feel more relaxed, more happy, and they contribute regularly. So that is a buy-in from the system. We are also seeing a positive impact the way the government officers and managers are adopting the system, because that's a big piece of work for us. It is still work in progress, but we are seeing decisions now being made at higher levels, at the state level, at the national level, based on data that they are getting into the system. So there is a greater buy-in that we are seeing. So these are some of the system benefits that we are seeing. Of course, in addition to the improvements in stock positions and reduction in stockouts and those kind of things, which obviously are taking place. But I'm seeing a very good system strengthening benefit that is emerging across all the levels.
Mustafa,
Yes.
I know firsthand how difficult it is to sell a new idea in Nigeria, but do you have any unexpected benefits from your implementation?
Thank you very much. Yes, we had several unexpected benefits, actually. Just as you said, it was actually difficult beginning to sell the idea. But then once the idea got rooted in, it became like the magic solution to everything. It created a pool of enthusiasts, so much that I could not even believe it, that on Christmas Day, on Salah Day, people were reporting their data. They were willing to share their data. It's the first time something like that has ever happened. I don't know. All the people that have been in Nigeria, I'm sure it was really very exciting to almost all of us. And that was one unexpected benefit. But in addition to that, I think this issue of culture of data has now taken in now. Everybody knows that every Friday I have a duty to perform. If I don't want to be red, I don't want to be yellow, but I want to be green. So I have a duty to perform. I think I need to get up and perform that duty, including the national people providing the feedback to the entire chain. Because he knows that every Saturday I've got to feedback on everybody. Otherwise, next week, I'll dampen their morale. So I think that culture of change that has happened is really extraordinary. Then we never thought that this simple dashboard could actually also be the converging point for people to learn new skills easily. You know, we had in the ERP tool, the robust standard tool that we all use. That's the enterprise resource platform tool that we use. But nobody was using it. Then we now try to bring this culture of change around this dashboard that we didn't expect into this, and we saw an astronomical jump from usage of 3% to about 95%. People were happy. You say, oh, no, so things could be this easy? I never expected that we'd get that kind of change. Another one was that other partners, you know, Nigeria is very big, and you have multiple players, everybody doing one or two things here and there. But suddenly they found interest in what we're doing, and it's, I think this is the solution, this is where to go. And they started buying into our solution, coming to us, and we became like the bride everybody wanted to court, you know? And say, hey, what you are doing is beautiful. I think that is another important unexpected benefit. Above all, I think the ability to be able to escalate issues and get people to conform to standards, I think is also one of those few unexpected benefits. Because right now, as I speak, my executive secretary has a monitor in his room. He has called this morning. Oh, I saw this place was red. What's the problem? So, in fact, as I was sitting with Pamela, I was replying a mail, and I told her, please, just keep your questions down first until I finish replying this mail. So I think these are the whole thing. It has engendered a movement. Let me just put it there. It has engendered a movement for good data quality to make the whole system work.
Thank you, Mustafa. And Ruth, are you also a bride now? Are you being courted by everybody?
Yes, actually, these benefits that my colleagues here have highlighted, we have seen them also in Mozambique, but I want to just highlight one that I actually quite amazed me. I said in the beginning that in Mozambique we did have resource constraints, and so we had to work with what we had to get the results that we wanted to get. And so I'm just going to pick up in Nyasa province, because we also have Dr. Ramos here, who is going to share with you also how data visibility has actually helped him manage in his province and improve performance. What I saw there is that resources can be reallocated to address the most needed areas of improvement. An example, for example, in Nyasa was with data visibility, which is something they didn't have quite well in the past. They were able to see how poor their cold chain was performing, and they made a decision from analyzing that data that we want to change this. And they moved around their resources, and they were able to put somebody to go and do preventive maintenance and corrective maintenance in the whole health facilities. And we saw through the data how the curve just started going up. And we all clapped for them. They clapped for themselves, and they were pretty happy about their performance. But what I'm bringing out here is that sometimes resources that are scarce can be badly managed if people do not know where to invest in order to improve their performance. But when they have the data that tells them what is going on and where you need to put more effort, people and managers are hungry for this kind of thing, and they can use that data. So that was quite amazing. I also saw how motivated people get to be through the feedback loops from the analysis of the data. My colleague from Nigeria also touched on that. We have seen that the VAN has actually a means also to support supervision, because we don't have much resources for people to go out and be physically there. But when they, to supervise or to provide technical support, but when you can visualize the data, and then you are able to, either through SMS, through WhatsApp, through a call to that health facility to question the data that they're sending up, you can really see that people are beginning to be aware that someone is looking at the data, because traditionally data would be collected and be sent up the hierarchy. And because there's never feedback, sometimes they don't even know what the data is used for. But that feedback coming back to them and even showing them how their facilities at the facility level is performing, how your district is performing, which ones of your facilities are working, doing well, and which ones are struggling. You help managers to actually supervise and incentivize better performance. And those people that are actually doing the jobs are also incentivized by seeing that, their supervisors, pat them on the back when they're doing well, but they are also pushing them for better performance. I thought that was a good tool, also using the van for supervision and for technical support.
Thank you, Ruth. Like you have all shared with us, you can see that building your van can be addictive, and you can get carried away. So, Harshal, what is your vision for where you want to go? I know you're working so hard. And,
I think from a P&G perspective, the van will continue to exist. I think it will evolve based on the business need. But I also think it's going to be more digitized. Where we are today and where we were a few years ago, we've changed dramatically. I think digitization is going to be a key enabler to drive the business forward. But also at the end, there's a big push today behind end-to-end synchronization. And that's really about starting from the consumer you serve or the patient you serve. When do they need that specific product? And are you triggering the supply chain to support that? And once you get that right, the van is going to just be an enabler to deliver on that end need, which is at the end of the day, in a P&G world, the consumer. In the medical facility, it's your patient, right? You want to make sure that when they come to you, you have the vaccine available at the right time, at the right price, in the right quality. So I think from a P&G perspective, the van will be there. It will evolve. It will digitize, but it will also make sure it delivers on a certain business need that's available at that time.
Khadija, I went around yesterday and I found some very interesting ideas. You're doing a great job in South Africa. And what is your vision for where you want to go?
Well, when the stockout crisis first hit us, I was new in my role as the director at that time in 2014, and we were hauled up to the 28th floor where the minister sits. And the minister says, "I'm a medical doctor. I don't do postmortems." He wants to do a diagnosis. And just keeping those words in mind, thinking, what does the man want from us as healthcare professionals? Okay, we're not in the business of making money, but as healthcare professionals, what does he want from us? He wants us to build resilient systems responsive to what we need, right? Currently, we're doing a lot of good work, thanks to my brilliant team, which you're going to meet in the next session. We are doing a lot of good work, but it's just the start of a bigger vision, right? We don't have end-to-end visibility, but we have the building blocks in place already. I think interoperability of the systems is needed as we go forward to make sure that, all the systems aligned, we get that end-to-end visibility, we get the roles and responsibilities clarified, people know what they must do. When we did the contract for the ARV tender, and I'm sure you guys know that South Africa is the largest ARV program in the world, and one of the first contracts that I had to put in place was for the ARV tender, and we interacted with suppliers. And one of the things they told us is that if you improve your forecasting, we can bring the prices down by 20 to 40%. So if we improve our forecasting accuracy, we can actually gain the efficiencies from that. Save money, build it into the system. just bringing all the pieces of information together from our cell phone SVS system that you're going to see used at primary healthcare clinics, to our electronic stock management systems used at the hospital level, our warehouse management systems, using the supply information, bringing all of that together to make sure that whatever decisions we make, whatever we do, we're building this resilience in the supply chain. And ultimately for me, I'm not a private sector person. For me, it's about not making the postmortem or not being part of the postmortem, but being part of the diagnosis, making sure that the patient has their medicine when they present at the clinic. I think of, my team and I, we say, not on my watch. We don't want patients turned away on my watch.
Manish, you also have your vision.
I think the first vision is scale. We are talking about scaling up the platform, the Even platform across India, which is huge. We're talking of close to 27,000 health centers. We're tracking 650 million doses of vaccine that are procured annually in real time. So scale is a vision. We have to scale it up. What it means also is that the human network, almost about 1,000 people supporting it. In terms of data, it means currently we are about in 40% of the country, and we have about 2 terabytes of data already, and you can expect it to double, triple, quadruple. So it'll be a big, big data structure. We're talking of moving towards that and using predictive analytics to actually optimize and improve efficiencies and effectiveness of how the system responds and works. In the longer vision, of course, the idea is in a country like India, if you can optimize and streamline the vaccine pipeline from the manufacturer level right down to the last end user, you would have reduced a lot of wastage and unnecessary procurements and thereby improving efficiencies, saving costs. In many ways, the savings pay for the system itself, so it's very cost effective. Also, we see more automation coming in a way that it reduces human errors and takes on a lot of functions that are automated, order management pieces coming in. So the whole system then works much more smoothly and efficiently for us. I think these are some of the key pieces in the longer term. All of this will help the government actually strengthen its health system overall. I mean, this is a piece in the bigger picture of the health program in India. So this is how we see it. And eventually, this can be linked with other commodities and equipments and other things. So there could be a basis of a much digitized, better functioning supply chain system in the country. So this is where we are.
I think you're doing a very great job considering the challenges, the population, and everything in India. Mustafa, where do you see yourself in 10 years, 20 years down the line?
Well, with Nigeria, I think we still do have quite a lot of challenges that we need to overcome. But I think we have already envisioned a process where you bring all the data systems together in one place and to make sure that they all work and talk to each other, meaning you have the dashboard is coming on board, the Navision is working, the DHIS2 is also working and linking, and the data is converging. And even the last mile solutions you are bringing on board have a place to sit. They have a receptacle in that system to sit, to work, so that you really have good quality data for decision making. Because quite often times it's not just about we've used the vaccines also, but how well you've utilized the vaccines and how well you've also managed the systems. There are such data companies that need to actually also come in. And but just as I've said that David has actually widened our vision, we are looking forward to not just let it stop at that LGA level where it is today, but take it down to that health facility level. And right from the beginning, we started the journey and we actually tagged it and captioned it end to end. Yesterday on the field trip, I learned that the end in some of their pharmacy direct distribution was actually the patient. So I actually also want to stretch the end from just the facility endpoint that we've marked initially, Guy Fawkes, take it to the patient. But beyond that, I want a system in place that will be actually real-time transactional. I mean, I've quite often described it to many people that it's just, I want an ATM in place for the van. So for every drug you take, where you take it, how you took it, you just slot it in and it keys in, and somebody else somewhere knows something like that has happened. And I think that is the vision we visualize, that possibly in the next 20 years, if we're able to get all the challenges across. I'm happy that the NSKIP has come on board, so we're going to broaden the scope. I'm happy that we have quite a lot of people that have come on board, UNFPA, USAID, so many people have come on board. So if they share in this vision with us, I think, don't worry about your 2,000 products, 5,000 products. We have a very robust base. We can accommodate all. And together with you, I think we can build this vision to have that ultimate transactional platform for all vaccines and medicines that are taken. I think that's where I want to take us to, hopefully.
Thank you. Ruth, do you also have the end-to-end dream? And what's your vision for Mozambique?
Yeah, so in Mozambique, we just introduced as I was saying, we had started in 4 provinces, which led into interest at central level. So the VAN advisor who is there, his vision, together with the Minister of Health, is to really establish this culture of use data at the central level all the way down and to the health facility level. So one of the things that he's going to be doing as he go along this is that he's going to be transferring the skills to the team, the EPI team in the Ministry of Health, to actually implement the VAN. And this will be scaled all over to all the 11 provinces in the country, and also systems for feedback loops to districts, and also to all the health facilities in all the districts is what we are looking forward to. And from that, we expect to have better performance from the EPI program. But we don't want to end there, because the medicine side is also engaging in robust systems for data visibility. And so as a country in Mozambique, we are also looking towards integration of systems so that the whole Ministry of Health has the culture of data use, and that the VAN is actively moving and providing the results that are expected, which is an increase in accessibility to healthcare products at the last mile.
Thank you very much, panelists, for those very beautiful discussions. I've learned so much today, and for me, what stands out is I've heard about end-to-end. We've heard about beautiful brides being courted, and but my favorite is going green. So, and I'm sure we'll all go green eventually. So you can catch the panelists later and engage them and ask them more questions. I know I will, so I encourage you to do that. Thank you very much for this session. Have a wonderful day.